Doctors confirmed 5 more measles cases in Indiana today. That brings the state's total to 6 cases, all of them discovered in Allen County, which is northeast of Indianapolis. At least 1 case of measles has also been confirmed here in Kentucky. It comes as U.S. leaders are monitoring an outbreak that started in Texas, where more than 500 people have gotten sick. Most of them are children and teens. So let's bring in Dr. Chris Bryant, a pediatric infectious disease specialist at Norton Children's. Thanks so much for being with us today, Dr. Bryant.
Thanks for inviting me.
Let's jump right into it. Let's talk about what parents, families, and the general public needs to know. What's measles and what are those symptoms to watch out for?
Measles is a very contagious respiratory virus. It is one of the most contagious viruses on the planet. You take 10 people who don't have immunity, you put them in a room, expose them to measles, 9 of them are going to get sick. Symptoms include fever, cough, congestion, red eyes like pink eye, and a rash that starts on the head and spreads down the body.
So what are some ways that we can protect ourselves?
Well, there's only one way to prevent measles, and that is to get immunized. The MMR vaccine is very effective. 1 dose is 93% effective, 2 doses, 97% effective.
So a lot of people say, I've had a dose, I think, when I was younger. Should they look into maybe getting another one again, or is that only for at-risk populations?
For most adults, 1 dose of measles vaccine is just fine. There are some groups of adults who need 2, healthcare workers, college students, and anybody traveling outside the United States. Now there's a lot of measles happening all over the world, and so optimizing immunity, getting 2 doses before you travel abroad is a way to protect yourself.
Great advice. And is there concern here in Kentuckiana that we could see more cases because of how easily this virus spreads?
When you look at the map of measles cases, there are cases in states close to us, like Indiana. We know that as people travel, they get exposed to measles, they can bring it home, and then people travel through Kentucky, and that could bring measles to us. So yeah, we need to be vigilant. We could have an outbreak here.
Definitely need to take those steps to protect yourself. All right, Dr. Bryant, thanks so much for your time today.